The main finding of our study is that we saw a dose-response relationship between maternal glycemic regulation during pregnancy and the risk of childhood obesity. In other words, the risk of obesity in the child increased across women whose blood sugar was controlled soon after a gestational diabetes diagnosis to those where control happened later or not at all. Interestingly, we found that children of mothers who achieved glycemic regulation soon after diagnosis, they did not have a higher risk of obesity compared to children of mothers without gestational diabetes. This is an encouraging message. Pregnant women with gestational diabetes who are supported to manage their blood sugar promptly can help improve their children's long-term health. So the dose response pattern that we observed in our study between glycemic regulation in pregnancy and childhood obesity shows that the in utero environment actually matters, and that babies exposed to high blood sugar in the mother may be more likely to develop obesity early in life. At the same time, it's important to acknowledge that childhood obesity is multifactorial. So postnatal factors like diet, physical activity, and the broader home environment, all of those can also influence a child's risk. But in similar studies that have examined the link between gestational diabetes and childhood obesity, they did account for these child behaviors, and the association between the in utero exposure and the child outcomes still persisted. So this strengthens the hypothesis that some of the risk may actually originate during the fetal development. The study highlights that the trajectory of glycemic regulation during pregnancy provides important information beyond the diagnosis itself. It suggests a critical window of intervention. Once a mother is diagnosed with gestational diabetes, she can work closely with her care team, including the OBGYN, dietitians, and nurses, to help achieve glycemic regulation and to support a healthier pregnancy. From the pediatrician's perspective, understanding the mother's pregnancy history can add valuable context when assessing a child's early obesity risk. In addition to knowing whether the mother had gestational diabetes, it can also be helpful to understand how well blood glucose levels were managed after the diagnosis, and whether glycemic control was achieved early or later in pregnancy. In an integrated healthcare system like Kaiser Permanente, this type of information can be more easily incorporated because pediatricians can access maternal pregnancy records through the shared electronic health records. But more broadly, improving communication between obstetric and pediatric care, whether through shared records or through structured maternal history in pediatric visits, those can help clinicians incorporate these insights into an early risk assessment. Talking about a mother's health before or during pregnancy can sometimes feel like a blame, but that's not our intention and not what we're saying. Our goal is to understand early life exposures that may affect a child's risk, so families can be empowered and can get the support they need. One way to avoid blame is to frame this information as just one piece of the puzzle. Pediatricians can explain that genetics, early exposures, and the child's environment all influence the risk. And knowing the mother's history helps guide more personalized prevention strategies, and that it's not a deterministic factor. The focus should be on family-centered supportive changes, encouraging sustainable habits around nutrition, physical activity, and overall wellness. Importantly, health is shaped by more than just individual behaviors. Factors like neighborhood environments, including access to healthy food and safe spaces, and the broader social conditions, all of those can influence the health of both mothers and children. And to better understand these influences, I recently received an NIH grant to continue this work and study how these social and environmental factors contribute to maternal and child health, which can help us better guide prevention strategies that address these structural factors rather than placing blame on individuals. So the overarching message is empowering. Many early life risk factors are modifiable, though some may be easier to change than others. By understanding these factors, Healthcare teams and families can work together to identify opportunities for prevention and for healthier outcomes across generations. So, childhood obesity remains a major public health concern, with about 1 in 5 children in the US affected, and the prevalence continues to rise. Because of this, pregnancy itself represents a critical window for prevention. Supporting mothers in achieving good glycemic regulation during pregnancy may help set the stage for healthier outcomes for their children.